Welcome to The Explainer. All right, today we're tackling a big one. It's a condition that affects millions of people, but honestly, it's so widely misunderstood. We're talking about heart failure.
Let's just start with a number, and this one really puts it into perspective. In the US alone, that is how many people are living with heart failure right now. I mean, think about that. It's so common, in fact, that it's one of the main reasons anyone over 65 ends up in the hospital.
So we hear the term heart failure all the time, right? But it's a bit misleading. It doesn't mean your heart has suddenly stopped working. Not at all. It's a chronic condition, something that happens over time. And what's really going on inside the body is way more complex.
Okay, so what is actually happening? The best way to think about it is this. Your heart is the engine for your whole body. In heart failure, that engine just can't pump effectively anymore. It's either gotten too weak or maybe too stiff to get that fuel, oxygen-rich blood, out to every part of your body. And when your tissues and organs aren't getting enough fuel, well, they start sending out alarm signals. And those alarms, that's what we call symptoms.
Now here's something that is absolutely key to understanding everything else we're going to talk about. Your heart isn't just one big pump. Nope, it's actually two pumps working right next to each other. You've got the left side and the right side. And here's the crucial part. Heart failure usually starts on just one of those sides. And which side is failing? Well, that totally changes the symptoms someone is going to feel.
And this really breaks it down for us. It's all about plumbing, It's like a traffic jam. When one of the pumps gets weak, things start backing up. So if the left pump fails, the backup, it floods right into the lungs. That's where you get breathing problems. But if the right pump fails, that backup floods the rest of the body's plumbing, all the veins. And that's what causes swelling pretty much everywhere else.
Okay, let's zoom in on left-sided failure. Since all that fluid is backing up into the lungs, it makes sense that the classic symptoms are all about breathing, right? We're talking about things like a nagging, hacking cough that's way worse at night, or just feeling really short of breath. And in the most serious cases, someone might even cough up this frothy, pink-tinged stuff, which is a major red flag for a life-threatening condition called pulmonary edema.
All right, now let's flip to the other side. What about right-sided failure? Well, here, that fluid traffic jam is happening all over the body. It's systemic. And this is where you start to see those really visible signs, like swelling in the legs and ankles, or you might notice the neck veins bulging out. Sometimes even the abdomen gets swollen and bloated. And all that extra fluid just sitting in the body, it adds up to one thing: quick, obvious weight gain. So you're probably wondering, doesn't the body have some way to fight back, to fix this? And the answer is, yes, it tries. It really does. But, and this is kind of a cruel twist, the body's own defense mechanisms, its attempts to compensate, actually end up creating this dangerous, vicious cycle that just makes everything worse in the long run.
And this right here, this is the core of the problem. When the body senses that the pump is failing, it basically panics. It hits the accelerator hard. It tells the heart to beat faster, to beat harder, and it clamps down on the blood vessels to jack up the pressure. Imagine trying to fix a sputtering engine by just flooring it, redlining it, 24/7. Sure, it might work for a minute, but it's a short-term fix that leads to total burnout, and it just makes that already weak heart even weaker.
So, okay, if the body's own solution is actually a huge part of the problem, then how do we help? Well, modern medicine is all about one thing: breaking that vicious cycle. The whole goal is to interrupt those harmful responses from the body and give the heart some real support.
And the strategy is pretty straightforward, really. It's a two-part plan. First, you have to do everything you can to reduce the heart's insane workload. Just give it a break. And second, you've got to help that weakened pump work smarter, not harder. And to do that, we use a combination of medications and some really important lifestyle changes.
So how do you actually help a struggling engine? You make its job easier, right? This chart lays out the whole game plan. First up, we need to reduce preload. Just think of preload as the amount of blood filling up the heart before it pumps. Right now, it's way too much. So we use drugs like diuretics to get rid of that excess fluid and lighten the load coming in. Next, we reduce afterload. Afterload is the resistance the heart has to push against to get blood out. It's like trying to pump water through a super narrow hose. So we use things like ACE inhibitors to relax those blood vessels, basically widening the hose and making it so much easier for the heart to pump.
And finally, we want to enhance contractility. This is just a fancy way of saying we want to improve the pump's force. And believe it or not, some drugs, like beta blockers, can actually help the heart muscle pump more efficiently over time. It's this three-pronged attack that gives the heart the break it so desperately needs.
Now listen, it's not all about pills. A simple but incredibly powerful tool is diet. See, sodium, salt, makes your body hang on to water. So by cutting back your salt intake to just 2 or 3 grams a day, that can make a huge difference in reducing fluid buildup. And less fluid means, you guessed it, less work for the heart.
Okay, so beyond the clinic and the pharmacy, successful long-term management of heart failure, it really comes down to the person living with it. It's all about empowerment, giving people the tools and the knowledge they need to take control, with some simple, proactive daily habits.
And one of the best tools for that is this easy-to-remember acronym, MODS. Think of it as a daily self-care checklist. M is for medications. Are you taking them like you're supposed to? A is for activity. Are you staying active but not overdoing it? W is for weight. Are you checking it every single day? D is for diet. Are you watching that salt and fluid intake? And S is for symptoms. Are you paying attention to anything new or getting worse? Seriously, following this simple routine can make all the difference in staying healthy at home and avoiding another trip to the hospital.
And out of all those letters in MAWS, that W for weight, you could argue it's the most important one. That daily weigh-in, it's non-negotiable. Why? Because a sudden jump on the scale is the body's first and loudest warning sign that you're retaining fluid. It's an alarm that can go off days before you feel any other symptoms. It is the ultimate early warning system.
Look, all these tools for managing heart failure, they're amazing medical advances. But at the end of the day, they're all responses to a problem that's already there. And that kind of leaves us with a bigger question, doesn't it? We know that heart failure is often the last stop on a long journey, a journey that usually starts with things we can control, like high blood pressure or high cholesterol. So what if we focused less on managing the destination and more on changing the road we're on? Understanding this condition is absolutely vital, but maybe, just maybe, the biggest takeaway is that we need to build a culture of heart health from day one, so that millions of people never have to manage this condition in the first place.